I would like to call to the podium a patient of the Illinois Cancer Care, and she is going to give us a description of some of her experiences as a patient at this institution. So she'll step forward, please.
Thank you for your attention. My name is Wendy Lewis, and it's kind of dark up here. Okay. I'm flattered, humbled, and honored to be a part of CUREageous tonight. My heart is full of gratitude for all the support I've been shown, and I am lucky to be here, and it truly is because of everyone here. Before I get started, I have to admit I have a bad habit of making everything all about me. I'm guilty of using cancer to get what I want, and unfortunately, we still don't have a dog, but I'm working on it. On October 16th, 2012, I had a colonoscopy that revealed a tumor. Dr. Kaiser took a biopsy and told us we would know the results in a few days. 2 days later, Bill and I remember leaving Dr. Lilich's office after she had given us the cancer diagnosis. She also explained to us about a genetic disorder called Lynch syndrome. Dr. Lilich scheduled an appointment for us to see Dr. Seraites that same morning. We walked to the car, and Bill held me while I cried. I don't want to do this. We went to Bob Evans for breakfast. We looked around and smiled with hope that we would someday grow to be as old as the patrons enjoying their morning together. That was it for the crying. We were in Dr. Seraites' office while he drew me a picture and explained all the possibilities of living life without a colon. We had so many questions. What about Lynch? And when would I see the cancer doctor? My official diagnosis was rectal cancer. I was so determined on removing the cancer, I convinced my surgeons to schedule the robotic surgery. I thought to myself, if I can get my surgery scheduled in November, I'll be recovering before Christmas. My Lynch syndrome came back positive, and we met my oncologist, Dr. Nost, at Illinois Cancer Care. My surgery was postponed, and Dr. Nost would explain to Bill and I about radiation, chemotherapy, and surgery. This seemingly large mountain seemed very surmountable when you're at Illinois Cancer Care. My husband, Bill, started to take over, and I no longer had to keep the kids' schedule. As everyone checked in with Bill instead of texting me, Bill made things like groceries, laundry, homework, and shuttling the kids happen. Life with kids does not stop, not even with cancer. We wanted the children to live a normal life during my journey. I'm not sure how normal it was for them since I spent most of the day in my bed, but children are resilient. I have yet to know how this has affected them for the future, but I do hope that they learn compassion, recognize the charity of others, and see more good than bad in our world. Dr. Nost sent me to Dr. McGee for a radiation consult, and I would undergo 25 radiation treatments. I have to admit that those treatments were the hardest part of my mountain. The staff at Radiation Oncology would always welcome me with smiles, make me feel at home, and hydrate me with fluids. I felt cared for there, and I knew the people there were helping me get well. After radiation, my surgery was done in March by a great team of Dr. Seraites, Dr. Crawford, and Dr. Corey. I've been told that I had the best of the best work on me during that 7+ hour surgery, and I have no doubt that I did. And I will be forever grateful to them and everyone else that was there that day. Chemotherapy consisted of 8 treatments every other week, and it gave me time to think and reflect on life. I was fortunate to have visitors and many prayers while I sat through my treatments. My body handled chemo pretty well, although I still have neuropathy in my feet. 15 years ago, I sat next to my mom in a hospital bed, and she had leukemia. I remember being faced with the decision of whether she would do chemotherapy or not. I said to her, let's do it for the kids who will need a cure. We started immediately, and right before bedtime, my mom was infused with chemotherapy while she slept. She completed her treatments, and after a short remission, I lost her. My mom was my best friend, my hero. Her unconditional love is greatly missed. My dad lived in Florida, and I was in Illinois. With the distance between us, I never knew when I would see him again. He was diagnosed with cancer more than once. I never knew when I would see him for the last time, the last hug, that last smile, his great laugh. Leaving him by driving away or walking into an airport was difficult. He died of colon cancer 3 years ago. As you can see, cancer has been a part of my life for a long time. And just yesterday, I was told my Aunt Dory had bone cancer and spots on her liver, metastases from her breast cancer years ago. I'm going to visit my Aunt Dory this Sunday, and hopefully it won't be the last time. My last scan was clean, or NED, and I praise God. I couldn't convince Dr. Nost to let me keep my port. He said to just go into Serady's office and get it removed. He talked like it was the same as going through a McDonald's drive-thru. With Dr. Nost, Nancy, Dale, and all the staff at Illinois Cancer Care, it does seem that easy. If there's one thing that I'll miss about this last year, it's that port. It made getting all those labs so easy, especially for me, since I'm usually difficult to get blood from. Sometimes I forget how hard this mountain has been, and I guess it's kind of like childbirth. All the pain and misery is overshadowed by joy that is experienced because of all of you. I have a Caring Bridge site that I occasionally update to let people know about my journey, and I posted once that my drive to Illinois Cancer Center was beautiful. I asked my readers to take the time to notice their surroundings. My friend Hattie took that to heart. As she noticed the bright blue sky, she backed into her husband's car. Today I have no cancer, so I guess that makes me a survivor. It's hard for me to say that because I really don't think of myself that way. The word survivor has mixed emotions for me. Yes, I've been through a lot and I've won this battle, but it can't end there. For myself and so many others in this world, we have to continue the fight. The real mountain I face here is the effects it has on my children. Genetically, they have a 50% chance of inheriting Lynch syndrome. Not a gift a parent wants to leave their children. My oldest boy, Jacob, will graduate from high school next spring. I worry about my children, Kathleen, Sarah, and Matthew. My family and I have some difficult decisions to make about when my kids should be tested for Lynch. This is just one reason why research is so important. We need better ways to prevent cancer, new methods of early diagnosis, and therapies with few side effects that turn cancer into a condition you can live with and not die from. I'm here today because of all of you, and I thank you.
Wendy, thank you for sharing with us your very personal story.